In this video, we will talk about pharmacy benefits managers, their effect on GLP-1 meds. Can anything be done? Without them, would GLP-1 meds be less expensive? So make sure to watch the full video. GLP-1 medications like Ozempic and Wegovy are changing lives by helping people manage diabetes and lose weight. But many patients are shocked by the high costs of these drugs. Behind the scenes, pharmacy benefit managers, PBMs, play a major role in how these prices are set. PBMs act as middlemen between drug companies, insurance plans, and pharmacies, but their actions often drive prices up instead of bringing them down. In this guide, we'll explore how PBMs affect the price and access of GLP-1 meds, and whether reforming or removing them could make these life-saving treatments more affordable for everyone. 1. How PBMs influence the price of GLP-1 drugs like Ozempic and Wegovy. Pharmacy benefit managers, PBMs, are third-party companies that work between health insurance plans, drug manufacturers, and pharmacies. They were created to help control drug costs and simplify the system. However, over time, their role has grown significantly, and not always in ways that help patients. PBMs decide which drugs are covered by insurance, what you pay out of pocket, and even which pharmacies you're allowed to use. When it comes to GLP-1 drugs like Ozempic and Wegovy, PBMs often ask for big rebates from the drug manufacturers in exchange for placing those drugs on their preferred lists. These rebates can be worth millions. Drug makers, knowing this, raise the list prices of the medications to make room for those rebates. So even if insurance covers the drug, the original price goes up, and many people without great insurance end up paying much more. In theory, PBMs are supposed to make medications more affordable. But in reality, their complex pricing deals often hide the true costs. Patients are left confused and stuck paying high prices for essential medications. GLP-1s are life-changing for people with diabetes or obesity, but PBMs are a major reason these treatments remain out of reach for so many. 2. GLP-1 medications and PBMs, who's really driving up costs? At first glance, it seems like drug companies are the only ones setting high prices for GLP-1 medications. But the story is more complicated. PBMs have enormous power in the drug pricing system. They act like gatekeepers, deciding which drugs make it onto your insurance plan's list, and which don't. Because of this control, drug companies often offer large rebates to get their products covered. These rebate deals might sound good, but they don't always help the patient. The rebates go to PBMs, not directly to the people who need the medication. This creates a system where drug makers increase prices so they can offer bigger rebates, keeping PBMs happy. Meanwhile, patients are stuck paying more, even though there's supposedly a discount in place. For GLP-1 drugs, which are now used not only for type 2 diabetes but also for weight loss, this pricing system becomes even more damaging. More people want access to these medications, but PBM practices keep costs high and access limited. Until there's more transparency and reform in the system, the real winners are the PBMs, not the patients. 3. Are PBMs making GLP-1 medications more expensive than they should be? Many experts believe PBMs are contributing to the high cost of GLP-1 medications. Instead of lowering prices, their system of hidden fees, rebates, and complex negotiations has created a market where prices keep rising. Drug companies are forced to raise the starting price of their medications just to participate in PBM programs. PBMs often select drugs for coverage based on how large the rebate is, not on what's best for the patient. This means that the drug that works best for someone might not be the one that's covered, or it might come with a high out-of-pocket cost. For people needing GLP-1 drugs to manage their health, that can be a huge obstacle. In a more open pricing system, costs might be lower because there wouldn't be a need for inflated list prices. But with PBMs involved, prices remain high and complicated. Patients deserve access to affordable medication without having to deal with confusing middlemen. 4. Cutting out the middleman, would GLP-1 prices drop without PBMs? Many people wonder, if PBMs were removed from the system, would GLP-1 drugs become cheaper? There's a good chance they would. Without the need to offer large rebates to PBMs, drug companies wouldn't have to inflate their prices as much. This could lead to more reasonable pricing for patients and insurers alike. PBMs defend their role by claiming they negotiate better deals and save money, but studies show that their savings don't always reach the patient. In fact, their hidden profits often come from the difference between what they charge insurers and what they pay to pharmacies. It's a system that rewards middlemen while making patients and taxpayers spend more. If PBMs were removed or heavily regulated, the pricing system could become more direct and transparent. This would force drug companies to compete based on price and value, not backdoor deals. It's not a perfect solution, but it could be a major step toward making GLP-1 medications more affordable. 5. The role of PBMs in GLP-1 access and affordability. PBMs do more than set prices, they also control which drugs are available through your insurance. For GLP-1 medications, this can create major barriers to access. A PBM might decide that a certain drug isn't preferred, meaning it's either not covered or it costs much more for the patient. This system makes it hard for doctors to prescribe the best treatment. Even if a GLP-1 drug is the most effective option, the patient might not be able to get it due to PBM restrictions. These rules often force people to try less effective medications first or jump through unnecessary hoops. Affordability isn't just about price, it's about access too. If a drug is priced high or blocked by a PBM, it becomes functionally out of reach. This is a serious issue for people who rely on GLP-1 medications for diabetes control, weight loss, or other health concerns. 6. GLP-1 drugs and the PBM dilemma. What patients should know. Patients need to know that PBMs can heavily influence what medications they can get, and how much they pay. Most people don't even realize what PBMs are or how they operate. But for anyone taking GLP-1 drugs, PBMs are often the reason behind delays, denials, and high copays. PBMs decide on formularies, which are the lists of approved drugs. If your medication isn't on that list, you could be stuck paying full price, which could mean hundreds or even thousands of dollars a month. This leaves many patients frustrated and confused, especially when they've already been told the medication is right for them. Patients can push back by working with their doctor to file appeals or request formulary exceptions. It's also helpful to stay informed and support efforts to reform PBM practices. More awareness and pressure from the public can help drive change in a system that is badly in need of it. 7. Can we lower the cost of GLP-1 medications by reforming PBMs? Yes, reforming PBMs could lead to lower prices on GLP-1 medications. One way is to make their pricing and rebate systems more transparent. If PBMs had to show how much money they make from each deal, it would be easier to hold them accountable and reduce hidden costs. Another reform option is to require that PBMs pass more of their rebates directly to consumers at the pharmacy counter. Right now, PBMs keep most of those savings, but passing them on could lower what patients actually pay. This would provide real financial relief to people who depend on expensive medications. Government policies could also help by limiting how much PBMs can profit from each transaction. There's growing support for laws that increase transparency, eliminate spread pricing, and reduce rebate abuse. These steps won't fix everything overnight, but they could make GLP-1 drugs far more affordable in the long run. 8. PBMs versus patients. The hidden cost battle behind GLP-1 prescriptions. There is a hidden battle going on every time someone tries to fill a prescription for a GLP-1 drug, and PBMs are right at the center. Most patients never see this fight, but it's happening behind the scenes between drug makers, insurers, and PBMs. Unfortunately, it's the patient who ends up losing. The list price of GLP-1 medications is often high, not because that's what the drug costs to make, but because PBMs demand big rebates to include the drugs on insurance plans. This system is full of backdoor deals that raise prices instead of lowering them, as PBMs claim to do. For patients, this means paying more at the pharmacy and facing complicated rules that restrict access. Whether it's being denied coverage or hit with a large copay, patients are caught in the crossfire of a profit-driven system. It's time for real changes that put people before profits. 9. Why are GLP-1 medications so expensive? Follow the PBM money trail. GLP-1 drugs are some of the most talked about medications today, especially for diabetes and weight loss. But their high price tags are keeping them out of reach for many people. To understand why, we need to look at where the money goes, and a big part of it flows through PBMs. Drug companies often raise the price of their medications so they can offer larger rebates to PBMs. These rebates secure a place on the PBM's formulary, which is essential for reaching patients with insurance. The higher the rebate, the more likely the drug gets coverage, even if it means jacking up the original cost. That money trail shows how PBMs benefit from a system that pushes prices up, not down. While patients are told their insurance covers a drug, they still face high deductibles or copays. The system is designed for profits, not patient care, and GLP-1 medications are one of the biggest victims. 10. Fighting for access. Can GLP-1 meds be affordable without PBMs? It's a question on many minds. If PBMs weren't in the picture, would GLP-1 drugs be easier to afford? Many experts say yes. Without the need for high rebates and exclusive contracts, manufacturers could offer lower, simpler prices directly to consumers or pharmacies. Some companies and healthcare systems are already experimenting with this idea. They're cutting out PBMs or working with transparent ones to set fair prices. In these cases, the cost of medications often drops dramatically, and patients are the ones who benefit most. The future of affordable healthcare may depend on finding new ways to get medications to patients without involving so many middlemen. Whether through new laws, innovative business models, or patient-driven advocacy, change is possible. But it will take time, and the push must come from those who are most affected. GLP-1 medications offer powerful benefits, but many patients struggle to afford them. One key reason is the role of PBMs, who influence prices through hidden deals, rebate systems, and coverage decisions. While they were designed to save money, PBMs often end up making drugs more expensive and harder to access. By shining a light on their practices and calling for reform, we can work toward a system that puts patients first. With more transparency, fair pricing, and fewer middlemen, GLP-1 meds could become more affordable and accessible, giving people the care they need without breaking the bank. What do you think of our video? Let me know in the comments section below. If you enjoyed this video, make sure to hit that like button. Also, subscribe to our channel before you go. Thank you for watching.